Climate change undoubtedly is one of the major challenges facing the world despite emerging new challenges like COVID-19. Researchers say the impact is not just on the environment but also human beings and none more than the children. We have a report. Researchers on climate change say the alarming rate of the melting of glaciers, threat of catastrophic glacial lake outburst floods, prolonged cold and heat waves, and climate change-induced food insecurity have a severe impact on children in Nepal. After extreme events such as floods, diarrheal illnesses related to breakdowns in drinking water supplies and sanitation can take more lives. This does not help Nepal, as the Multiple Indicator Cluster Survey 2019, prepared by the National Planning Commission, Central Bureau of Statistics and the UNICEF, paints a bleak picture. Over 85% households from more than 12,000 were found using drinking water contaminated with E. coli, while only around 18% had access to improved drinking water source meeting the WHO guideline. According to the Ministry of Health and Population, the effect of changes in water supplies and erratic weather conditions such as prolonged cold waves result in infectious threats on children.
Climate change affects the health of the people, especially children, for the growth, development, psychological and physical. And flood and the temperature change has got adverse effect on the neurodevelopment of the baby, children. And then there is a decreasing amount of running water originated from the Himalayas. And the atmospheric air is also contaminated and polluted highly, and then this has got the negative impact on eyes, nose and throat and lungs of the baby.
Development experts are univocal that climate change, parallel to unplanned construction works, especially carving of roads in mid-hilly region, has resulted in a record number of landslides in Nepal in the year 2020. This left the children most vulnerable not just to the disaster but also to the spread of new diseases. Nepal Burden of Disease 2017, carried out by the Ministry of Health and Population, Nepal Health Research Council and the UK aid, states that childhood diseases have declined in Nepal in comparison to 1990. The progress is attributed to successful implementation of prevention programs such as immunization and community-based interventions for diarrheal diseases and acute respiratory infections. Efforts from the government of Nepal in regards to improving environmental conditions, ensuring access and upgrading the health facilities with the ambitious plan of a hospital in every local level and better immunization rates are certainly likely to curb the child mortality rate. Despite notable progress in the last decade, a lot remains to be done to address the impact of climate change on children in the country.
The role of educating children about climate change, its impacts, and especially about the ways in which the risks can be mitigated is important, especially when they have practical implications. Something as simple as making sure that children know that they have to be well hydrated when there is an event of extreme heat could decrease the cases of heat-related child morbidity and mortality amongst children. And I think another important avenue is children activism, and it is already starting to garner a lot of international attention.
Prarambha Dahal with camera person Kumar Sharma, Nepal Television News.